Hi everyone, Ryan here from Easy Living, and I'm also joined with Teresa Jackson, our Director of Care Management, doing another one of our awesome Ask a Care Manager videos. Thank you so much, Teresa, for joining us. As you guys know, Easy Living is a home care and care management agency, been around for over 20 years, serving the Tri-County, Pinellas, Pasco, Hillsborough area. And so we're doing this weekly video series to help those out there kind of answer some questions about what our care management services do, how that can tie into our home care services, and kind of taking the news that happens. It's really kind of changing day by day at this point, and trying to find out what are people asking, what are people worried about, what are they concerned about, and seeing how we can help use our services, our care management or home care services to answer those questions. So Teresa, thank you so much again, as always, for joining us today. So most of us have heard probably in the last week or so that there's been basically an order from the governor that all long-term care facilities and assisted living facilities and nursing homes must report their positive COVID-19 coronavirus cases, whether that be with their residents or their staff. So it's been the hot topic in the news that all these different nursing homes and facilities and their patients or staff have tested positive, and we've seen some that have been much more affected than others. But again, as this virus spreads, we know this is basically an inevitable situation. So a lot of questions that, one of the main questions we've been asked, we've been hearing is, should I be moving my loved one out of these facilities? Teresa, what are some things that these families should ask themselves about their situation, or something that they should kind of find out if that's the right decision to move these people, their loved ones, out of a facility? Whether that facility has a positive test for COVID or not. It's just, is that something that they should consider? And what are some things that they should really think about, the questions they should ask to find out that's the right move?
Well, that's a very good question. So yes, it's difficult. It's a very difficult thing to consider. I mean, even if the facility that your loved one's in does not have any positive cases, right now the families are still not able to go in and visit their loved ones. And this is hard. I've talked to family members that, they've been married for 40, 50, 60 years, and they can't spend time with their spouse right now. They're separated, and it's very difficult. So again, we are hearing a lot of people ask about, should they consider bringing mom or dad home or their spouse home to live with them again. And before anybody makes a decision, you really need to sit down, maybe speak to a care manager about the pros and cons of that decision. And one of the first things that I would ask is, well, why did they move into a facility or an assisted living community to begin with, or a nursing facility to begin with?
Sure.
Maybe at that time, they were having behavioral issues, or incontinence is one of the largest, or one of the main reasons that someone has to move into a facility. So to look at where their level of care is at this time is going to be crucial. And that's something that I could help, or a care manager could help sit down and go over.
Yeah, because you guys, you're taking an objective look at this, because, what the family member might think is what the situation is might not be a realistic outlook on what really the needs are at that point in time.
Well, exactly, because the family member is going to be emotional, and they're going to make an emotional decision. And then you're going to bring mom home and realize that even if you're bringing her back to live in her home, she might not remember that home anymore.
Yeah.
So she might feel like now she's in a stranger's home. Or think of all the family members that they're not just considering bringing a family member home to take care of, but they're also now working out of the home. They're also maybe assisting children doing homeschool. And we still need to make sure that that family unit is protected. So they would have to be some type of social distancing put in place, and you'd still have to follow all the necessary measures and even take more precautions, because you're going to go out to the grocery store. If you're coming home and your loved one that is at risk is there, you need to be even more careful that you're not going to be bringing in the virus to them now that you're taking over the primary care.
Yeah, and that's, and having another person in the home too is potentially another mouth to feed, and also, the necessary medical equipment they might require an addition, and which would require, maybe more trips to different stores too, to get what is needed to take care of them in the home.
And even, most assisted living facilities and nursing facilities, the physicians will come in to those communities and those facilities and still provide care. Now, are you going to have to start taking your loved one back out to the community doctor? Or are you going to be able to set up telehealth visits? Some things can be done through telehealth. Mm-hmm. Removing a cast from someone's arm, trust me, you can't do that by telehealth. You're going to have to take your loved one to the orthopedic doctor to have that cast removed. Are you going to be able to transport that person? And again, with planning, it can be done. And maybe even with assistance from home care aides, it can be done. But again,
that's what I was going to say. Is that maybe just not making a rash decision. Like, we understand that it might be there's a sense of urgency to what they want to do, but like you just said, slowing it down, and maybe let's put a team together to help us make the right decision and have the experts in place to make sure everything goes smoothly.
Yeah, and it can be done. I actually have a friend who, her mother was in her assisted living community only for a short period of time before they started doing the lockdown and not letting families go in and visit. So they did move mom back home. She had not had much time in the facility, so she hadn't really acclimated to the community to begin with. But it's been a successful transition back home, though there have been challenges. Mom's fallen, and that's something that they're having to figure out and work through, and just make sure she's still safe at home.
Definitely makes sense, and that those are a lot of great questions that families should ask. And again, as I mentioned before, it's just as the virus spreads, and we're flattening that curve right now, and that's the kind of general consensus. But we also have to think about the long term. We can't just kind of rush back into getting back to normalcy. We're going to have to do things with more precaution, and we hopefully don't have a secondary wave come through. There's all these different discussions out there about what does the future bring. So as this progresses, I think more and more people are going to be trying to weigh their options. But I think what the main thing right now to do is to consult a professional like our care managers. Let them have that objective look on it and make the right decision, help you get everything set in place. So it's just about slowing down, not making a rash decision, and just making sure things are done correctly. So,
exactly.
Awesome. Well, Teresa, thank you so much for joining us again this week. If anyone has any questions or comments they'd like to put in, please put it in the comment section below, or you can visit our website and submit a question through our website also. It's www.easylivingfl.com. So thank you so much for joining us again, and we look forward to seeing you all next week. And thank you so much, Teresa, for joining us.
Thank you, Ryan. Bye-bye. See you later.
Have a good day.